New COVID-19 cases was down again yesterday to just more than 5,600.
235 people diagnosed with the virus have since died, bringing the total death toll to 81,830. Just under 155,000 cases are still active, with KwaZulu-Natal still having the highest number of active cases at just under 64,000.
The number of daily vaccine doses being administered still under the target of more than 300,000. More than 12 million shots have now been administered in South Africa. Well, as more and more people step up to take the COVID-19 vaccine jab, some are raising concerns about what are called breakthrough infections. This comes as the number of variants continue to rise. We're joined by Aisha Abdool Karim from the Bhekisisa Centre for Health Journalism. Aisha, good evening to you. Thank you for your time. How often are we seeing these infections happening, where someone actually gets COVID after being vaccinated?
Good evening, and thanks for having me on this today. So essentially, breakthrough infections are when somebody who has been vaccinated is still infected with the coronavirus and develops COVID-19. It's important to understand that these infections happen because no vaccine at this time for COVID can give you 100% protection. And that's measured by something called the efficacy of the vaccine. So Pfizer, which is one of the most effective vaccines, and it's what we're using in South Africa as part of our rollout, has around a 95% efficacy. That means that it's offering you 95 protection, and it makes you 95% less likely to develop COVID-19, but there is still a 5% chance that you could get sick after being vaccinated. We don't have a lot of data from South Africa as yet as to how many breakthroughs we're seeing. There have been a small number of breakthroughs documented from the Sisonke trial, which happened in healthcare workers with the Johnson & Johnson vaccine earlier this year. So we do know that there is a very small chance, but there is still a chance that you can get infected after being vaccinated.
So I say 5% of people, but I think you know what I mean, Aisha, the people who have that 5% chance of still contracting COVID-19, do they get severe symptoms, or do we actually find that the risk of getting severe symptoms is less than the 5 percentage points you talk about?
Yeah, so that's something that's very important that we've learned about the breakthrough infections, which is even though people are still getting infected, the majority of breakthroughs are actually asymptomatic or mild. So we're seeing, like, I think it's at this point around 80% of breakthroughs that have been documented in the US and some other countries predominantly are asymptomatic, which is when people don't even realize that they've been infected, or they have mild disease. And so that's a trend that we've also seen with people who were previously infected with COVID, then got vaccinated, and then if they have a breakthrough, so some people who had very severe disease the first time, or moderate disease where you have to you have more severe symptoms, they've had asymptomatic cases after being vaccinated. And again, some of the data coming out locally from the Sisonke trial has shown that the Johnson & Johnson vaccine is able to significantly reduce your chances of being hospitalized or of dying as a result of COVID, even if your infection is caused by a new variant like Delta. So that is why it's still so important to be vaccinated, because even if it can't give you 100% guarantee against not getting sick, it does severely and significantly reduce your chance of getting incredibly sick and needing to be hospitalized as a result of that infection.
So, in other words, Aisha, I suppose to sum it up, there's, from what you're saying, not much evidence that I can see that would say we need to change our approach when it comes to vaccinations. Generally speaking, they're working.
Yes, absolutely. The vaccines are doing exactly what they have been designed to do, which is to reduce the burden on the healthcare system and to save people's lives. And so in that sense, the vaccines are doing their job incredibly well. And the chance of that small 5% chance of getting sick should absolutely not be a deterrent for anyone, because it doesn't indicate that the vaccine is not working, because it's still offering you protection against hospitalization or a more severe outcome as a result of COVID.
Obviously, we're seeing more research into variants, and I mean, this is where things start to get very, very complicated. The new variant, which was being discussed at length yesterday, there's no confirmation yet on whether that, I believe the scientific phrase is, escapes the immune response. It would be quite some time before we actually know for sure around the impact of new variants on COVID-19 vaccines.
Yes, so as you said, we have there has been like a new variant that's been detected in South Africa, and as we know, the virus does change and does evolve over time, so it's likely that this won't be the last variant that we see. Most of the variants do have common mutations, so they're changing in a similar way, which is that they're able to spread more efficiently from person to person, and then of course the concerning component is this immune escape, where the vaccines may offer less protection against certain variants because of how they interact with your body cells. So we saw it with the beta variant, which is what drove South Africa's second wave, where it did reduce how much protection vaccines could offer us. But I think it's important to know that with the variants that we've seen so far, the evidence that we have from vaccines is that they are still offering protection. It may be slightly lower against a variant than against the original version of the virus, but you are still getting a significant amount of protection, particularly from the vaccines that are being used in South Africa, which is the Johnson & Johnson and the Pfizer-BioNTech vaccines. And there obviously still needs to be some research done about the newer variant, the C1.2, to see how that interacts with the immune system. But it's so far, from our previous experience with variants, it's very promising that the vaccines are working.
Aisha Abdool Karim, thank you very much indeed from the Bhekisisa Centre for Health Journalism. Do appreciate it.